Obstetrics diplomate in the USA. So I will now pass the mic to Dr. White. Doctor, you may begin.
Okay, thank you. Can you hear me?
Yes, all good.
Okay, wonderful. We're going to talk a bit about something. Okay, I hope that you all haven't had too much lunch, because today's topic, warning ahead. Let me share my screen first. Okay, where do I share? Okay, there we go. Can you all see this?
Yes, all good. If you could just make it full screen.
Okay, I will. Let me click on this and from the beginning. Okay. We start from the beginning first. So we're talking about infant stool patterns today, which is something that a lot of parents are very obsessed about. I'm the pediatrician from Bright Star Baby and Child Clinic. I'm at Bangsa, as our host kindly has mentioned, our MC. So again, warning, there's a lot of pictures that might not be so palatable ahead. So be careful, okay? I already warned you. So today we're going to talk about our baby's poop. Now, first of all, what are stools or what are poops? They are actually the waste product of the digestive tract. Now, this waste product is a compilation of water, bowel products, and whatever that the food products that has been digested. Okay. So the stools can be an indicator of baby's child's your child. Before I go on, how do I close this? This thing is blocking my.
Sorry. What did you?
The video at the side is all the participants at the side is blocking my view of the slideshow. I can't see clearly. Maybe I exit first. Hold on. Sorry. So okay, it's not moving. So sorry. Sorry. Hold on first. Stop share for a while. Okay. I can remove this. Hide this. Good. I can hide it. Sorry. Okay, from current slide. Okay, so we gone through this. The stools, the waste product from. Okay, so stools can come in a wide variety of colors, consistencies, as well as frequencies. So we don't have to say, oh, the baby must poo a certain healthy. It's there are just many normal variants to the stooling patterns. Okay, all right. So even in some babies, the poo can appear different as they age, or they can occur at different frequencies, and they can still be normal. So we don't want to stick to one thing and be so rigid about baby's poo-poo lah, huh? Okay, so I know that this is a very, very common topic, and parents get very obsessed with baby stooling patterns. Slight little change, oh, today less a bit, then I get so concerned. So try not to be too stressed about babies' stooling patterns. So I'm here to help you give you more information on what is normal and what is not normal, so that you don't get so stressed, okay? Okay, some of the basics that we always talk about when we ask about a stool history is that we ask the parents about the frequency that the baby is going, the consistency, watery, hard, the consistency. The third is the color of the stools. Sometimes we have what we call add-ons. Are there mucus in the stools, blood in the stool? Is the stool oily, shiny? The smell of the stools, as well, basically as well as the smell. So all these things gives a lot of information on your child's health. Okay. So let's go to newborn poo-poo first. So for newborn poo, first 3 days, all healthy newborns, they should produce a sort of sticky, sort of black, tarish looking poo called meconium. So as you can see at the picture there, the top picture there, there is this, sticky material there. So that's meconium. So meconium is actually made up of the amniotic fluid in mommy's womb, some mucus, as well as dead skin cells and other things that the baby ingested inside the mother's womb. So as you can see that the red circle there, also you can see the dark brown, sticky green, sort of almost black color. Okay. Afterwards, after the first 3 days, we'll separate it into breastfed babies versus formula-fed babies, okay? By day 3, 4, the baby who's breastfed will start to get this less black color poo, a bit more yellowish, greenish. It's less sticky, less mucousy, a bit more grainy looking poo. So these are called transitional stools. As you can see in the picture there, there is this greenish, almost a little bit yellowish looking stools there. So and then you can see the circle there, there's also this green looking, a bit more grainy. Grainy means that it's got like a chalkier color, got some substance to it. It's not so, it's not so translucent anymore, not so mucousy. So that's transitional. By day 4, 5, so after day 4, the poo will become the typical mustard yellow stools. You can see those purple boxes that I highlighted. So those are the yellow, mustardy, curdy stools. They can be quite watery, almost like a liquid watercolor, or it can be a bit more sticky, more texture to it. It can be curdy, meaning it looks like cottage cheese, like yellow color cottage cheese also. It can be like that. So that's still very normal. Now, for formula-fed babies, the stool should be soft, will usually be soft, but it is more firm than breastfed babies, okay? It is more firm, but it still should be around a yellow color, but sometimes it's more brownish. It can lean towards the brownish color, light brown or brownish green, okay? So we say that the color from 1, 2, 3, 4, you can see there on the top right, top left, that those colors are still considered normal. As you can see, not that one color is the better color, so you can have a range of it. And one thing about formula-fed baby is that their poo-poo can be more pungent, meaning got more smell, more kick to it than breastfed babies' poo-poo. Okay, and you can see on the lower left there, there's this picture here that the poo is more brownish. That's a very formula-fed baby's poo-poo. Okay, next. Sometimes parents will get nervous if they see green, especially if you see that number 2 is a little greenish, right? Green is still okay. Sometimes it's caused by the iron content in formula milk. Sometimes it's if baby is on iron supplement. Orange, yellow, or brown poops are also normal due to those bile pigments that are picked up in the gut. As the poo transits through the intestines, it will pick up some bile pigments, okay? All right. So another question that parents like to ask is, how often should babies poop? How often should babies poop? Very common topic. Now, early on in the breastfed baby, usually we count this as one bowel movement. BM means bowel movement. One bowel movement for every day of their life. So day 1, 1 poo. Day 2, 2 poops, and so on and so forth. That's general only, okay? You can have more, you can have less. As long as you're thriving and the baby looks quite well, it's still considered okay. Now, after day 5, the average breastfed baby will have about 5 to 8 dirty diapers a day. Some can be more, some can be less, but around the 5 to 8 dirty diapers is common. Now, can be very different from different babies. It can be one poo-poo diaper every few days to several a day, and that's still considered normal, okay? Some babies even poo after each feed. That's 8 to 10 diapers a day. Like my son, actually, when he was born, also he poo pretty much every feed and sometimes in between feeds. So can you imagine? That's a lot of dirty diapers to change, but he was thriving, so we were not concerned at all. Okay. By about 6 weeks old, the breastfed baby's poo patterns, you may see there's a little bit of change. You may see that on, especially on breastfed babies, that they don't poo every day. They may skip a day or 2 or 3. I have seen the longest also 7, 10 days also I have seen, but that's still normal. So it's okay. So don't get too panicky as long as they are still feeding well and they look generally not uncomfortable. Okay. So some babies will continue to poop many times a day or more throughout the first year. So it's their pattern, we say. That's how they are. So okay one. So again, some will go several days between their bowel movements. So no poo for many days. Again, as long as the poo comes out easily, is soft, and it's baby is generally quite comfortable, we are fine with that. So as you see, as long as it's easy to pass the stools, stool is soft, baby is growing and happy, do not worry about skipping poops, okay? It is not necessary to keep count after 6 weeks old. So you don't have to, give me a diary full of babies. Okay, today poo how many times? Today poo how many times? No need one. As long as baby is happy and gaining weight. So you see, I keep repeating this as long as baby is happy and gaining weight. It's because it is true. Baby, as long as they are comfortable and happy and gaining weight, we are not too concerned about their poo frequency. Okay, the number may change day to day, and that's perfectly normal as well. So for formula-fed babies, they typically poo about 3 to 4 times a day as a newborn. However, some of them can go as long as 3 or 4 days without a bowel movement lah. But typically they do poo lesser a bit than breastfed babies lah, 3 or 4 times a day. Okay, again, this is a long again. As long as baby's bowel movements are soft and pass without problems and no struggles, don't have to be too concerned about it. Okay, but if your child has problems pooping, doesn't go for more than 5 days and is on formula, or if baby is struggling, meaning a lot of straining and you can see hard stools, then probably it's time to talk to your pediatrician about this issue, okay? All right. The next thing that I like to talk about is the scary ones, the so-called abnormal stools. So we'll start off with, okay, this one is the most, I guess, the thing that parents fear a lot, bloody stools. Bloody stools. As you can see a picture on the left here, the stools are yellow, so it looks quite okay there, but it's mixed with some reddish, bloody looking material, and it's a bit mucousy as well. Seems a bit separate from the stools. It's not mixed into the stools. So if the baby is being breastfed, blood in the stool could mean is a sign of sensitivity or allergy to something in mommy's diet, because breastfeeding, right? So whatever mommy is eating, could it be that causing the baby to have blood in stools? The doctor may try to tell mommy to eliminate certain problem foods like dairy, soy, nuts, wheat, and peanuts in the mom for a few weeks to just figure out what's causing it. Or if your baby is formula fed, blood in the stool could also mean that baby is allergic to the type of formula that he or she is on. But it's not as common as what most people think lah. It's just one of the could be causes only, okay? Don't jump to it straight away. Have to find out slowly. Sometimes there is totally no relation between the milk that baby is consuming or whatever food that mommy is taking. So sometimes we do a little bit testing. We ask mommy to eliminate some of the foods, but still the babies continue to have some bloody stool. So what could that be? It could be that baby may have some small little cracks or little fissures in the anus, the anal region, that cause the bleeding. So another possibility, this is early on when newborn, baby may have swallowed mommy's blood if the nipples are cracked. So sometimes nipples cracking, they can have lots of bleeding. Baby can have, for sure, swallowed some blood from mama's nipple. And that blood can come out in the stool as well. Okay. All right, so we're done with the bloody part. I will go through a bit more in depth later on. There are other conditions that are quite serious as well. So the next abnormal stool that I like to talk about is the green frothy stools. Green. So you know the Chinese believe that if you have baby have green poo, it means that the baby got scared. So that's a myth lah, huh? So in breastfed babies, sometimes if you see green frothy stools, it could be a sign that the mom has a fore milk, hind milk imbalance. It can be a possible cause for the green frothy poo. Sometimes it can be normal as well, don't worry. So what is this fore milk, hind milk imbalance? It is because the mother is producing so much breast milk that the baby is swallowing too much of the watery, lactose-filled fore milk and not getting enough of the fatty hind milk. So it results in this tummy being overloaded with lactose because baby is still small, right? So not enough lactase enzyme to digest it. So sometimes it can result in this green frothy stools. Okay. Now, another cause of green frothy stools in babies could be that could mean tummy upset or a stomach virus, a tummy virus. We call it gastroenteritis. And also we talked about baby's intolerance to something in mommy's diet as well. Or it can be normal as long as the baby is happy and growing. However, we only sort of get worried or see the doctor or treat if baby is not growing very well, with the green stool not growing very well, very fussy, acting very abnormally, and also if the baby has some sort of infection, some sort of infection, meaning maybe a bit of fever or is vomiting, stuff like that, then see the doctor. But if the baby is well and happy and growing and wanting to drink, sometimes green frothy stools can be normal. All right, next we'll go to another type of abnormal stool, which is the bright red stool and mucousy stool. So if your baby is older than 6 months or already on solid, sometimes you may have the red colored stools because of the foods, because of the red color foods like beetroots and dragon fruits and stuff lah. The redness is mixed into the stools one. So this is not stool and then separately a bloody patch. It's not. It's usually a mix. The stool is red in color one. Okay, but this one is not. The second picture is not. It's really true bleeding. It also could be a sign of infection, allergy, or a bleeding hemorrhoidal tissue. It could be that. And you see the top left one, which is the blood and mucus is mixed into stools. That one is a bit worrisome. Mucousy stools are slimy and stringy. They usually mean a gut infection. Yeah, so usually the red one for sure, the top left one for sure means like some sort of infection or some sort of obstruction, something wrong with the gut, the intestines, okay? So those have to see doctor right away. The next abnormal type of stools also is quite common is the loose, very loose, watery, green, and very frequent stools. So we're talking about things like, so like this, as you can see in the picture, it's very watery. You can even see the water shine there. So loose, watery stools that are greener than usual. So can likely mean that the baby is having diarrhea. This occurs when either there's a change in baby's diet, or if you're breastfeeding, the mom is breastfeeding, if there's a change in your diet, or when your child has a allergy or food intolerance, and also maybe an infection as well. All right, maybe an infection as well if there's a loose stool. Diarrhea can lead to dehydration, so this condition warrants more monitoring. I will talk about diarrhea and vomiting and gut infection in another talk, in a separate talk, because that involves a lot more things. But if this happens, if you see loose watery stool and your child isn't acting very well, do see the doctor when this happens. Yeah. Now the next one is this thick black stools. Apart from the first 3 days, newborn days, thick black stools are not welcome, okay? Thick black stools like what you see here in this picture at an older age usually indicate a bleeding in the digestive tract, or there's an obstruction somewhere, which is very dangerous for the baby. This one is something that we say big no-no. Go to the doctors or the emergency department immediately if you see this kind of stools. Okay, so this kind of stools is shiny, mucousy, is black. The color is mixed into the stools one. It's not a separate kind of bleeding thing. Okay, we call them melena or tarry black stools. Okay, now apart from this, sometimes you may see this dark green, sort of black green color stools. That is not blood, it's dark green or dark brown. So sometimes iron supplements can cause that. Yeah, if a child is anemic and the doctor puts a child on iron supplement, it can make the poo-poo look a bit darker color. But it's black green, like not this kind of like reddish black color. Okay, all right. Okay, the next sort of stool pattern that we get very concerned about, okay, this one you all have to take note, is the pale chalky white stools. Pale chalky white stools, no color one, very pale color. Now like this picture on the top left. It's literally white color or ivory color. So this means that the baby has some an underlying condition that's very serious. And this bottom picture also, you can see this pale color stool here. So it means that the baby is not producing bile that can cause the stools to change color, or if there's something wrong with the liver or an obstruction. Okay, so this is a medical emergency and babies have to see the doctor immediately or go to the hospital immediately. So this is rare, but this is the one medical emergency that you have to bring to see doctor. Now next we talk a bit about oily stools. This picture didn't really show very clearly, but it's a little shiny at the top there. So oily stools, if your baby has shiny, oily sheen in their stools, it could sometimes mean that there's problems with baby absorbing nutrients in the digestive tract. So it is usually something I wouldn't say take lightly, just it's something serious, needs to be seen by the doctor immediately. It's because if they can't can't absorb the nutrients in their meal or their food, whatever, and it makes them have a risk of having malabsorption symptoms. So it's not good for their growth and their development as well. Okay, so see oily stools, do take note. I have to see the doctor. Okay, this is a bit more advanced. So in terms of children who are already starting solid, so around 5-6 months or so, sometimes their stools can be quite interesting looking. I have parents who bring their children's diapers, the dirty diapers, and show me. Sometimes we can even see what it is inside the stools. So the color and texture of stools can be quite variable, especially when they start solids, yeah. So when they are so new to digesting these new foods, right, you may see partially digested foods hidden inside the poop. So you don't have to be alarmed. They get better and better at digesting the food as they grow older, and they get used to the food as well. So some of the colors are quite shocking to parents, especially those bright, bright colored foods like carrots, or the red color of beets, or dragon fruit. Sometimes it can be very bright green for those who are on spinach, but there's really nothing to be worried about. Very, very okay. Okay, next we go to, instead of how the poop looks, let's go to the smell. Does the smell of the poo-poo, does it matter? Does it matter? Okay, as a general rule, the newborn poo-poos shouldn't be too smelly, but that's just a general rule. And we always say that formula-fed babies, they have a slightly more pungent, stronger smelling poop compared to breastfed babies' poop. And then the smell also, different formula brands will produce different kind of smell as well. It's quite normal. And different babies have different smell as well. Now, as babies grow older, their gut will pick up a lot more bacteria, normal bacteria, and hence the poop will be smellier. And this is also quite normal as part of the growing up process. So sometimes if babies have allergies or certain intolerances, it may make the poop smell a little bit more foul or sourish, a bit sour, like tangy. So if you're concerned that baby's poo is smelling a little different than usual, maybe you can discuss this with your doctor. However, again, this is some recurring theme. If your baby, however, is very happy, not fussy, thriving, meaning growing very well, generally very comfortable and loves feeding, and the poop looks okay, just smells a bit funny only, I think maybe you can just monitor, and it may be that this is normal for him or her. Huh? Okay, so the last thing is I would like to show you this thing called Bristol stool chart. It is a chart that sort of lets everyone know what type of poo-poo there is. And you can see type 1 is the one that we don't really like. It's the separate hard lumps like little pebbles. So we always try to say that if that's the case, then maybe there is a severe constipation related to these hard stools, hard pebble-like stools. Type 2 is hard, but it's sausage-like. It's still got that sausage format, but this is mild constipation. Third and fourth are soft. They're very soft. When you press on the diaper, you press on it, it's squishy one. Okay, these are so-called normal types. Type 5 are little blobs, Type 6 are quite mushy, and we call it mild diarrhea, if that's if you see that. And then type 7 is very liquid, no solid pieces, severe diarrhea. But if you think about it, right, babies, they don't have type 3, type 4 in the beginning. They're usually actually type 6 or type 7. And it's, so I will say use this chart, use this Bristol stool chart, but not but you must think of also the stage the baby is in. Young babies, you can't really use this stool chart lah, because most babies still have those liquidy, mushy poo-poo in the early stage. Later on, after they start solids, okay, then maybe you can use this Bristol stool chart, okay? So sometimes I say you can disregard the side notation here, those severe constipation, mild constipation, all those things are just for older kids, all right? So use it sparingly. We always say that as long as the stools, and no matter how they look or type, whatever they are, as long as they pass easily and comfortably and you are feeling okay, not to worry too much about what type it is under the Bristol stool chart. Okay. So yeah, any questions? I know I go too fast sometimes. You can ask me questions, or I can go back to my slides. Okay. So any questions so far?
Okay, so for our participants, this is the time. If you have questions, just put it in the chat and we will ask Doctor the questions for you. But first, we do have a couple questions already, Doctor. So,
Okay.
How do I know if the formula, the milk formula is not agreeing with the baby?
Okay. How do I know? Okay, so sometimes we say if the baby has, every time take the formula, baby is appearing very uncomfortable, have a lot of spit ups, very gassy, that sort of things. As well as I mentioned just now, if the stools are very loose, or if baby has blood in the stools, okay, and just generally acting very unwell, do go and see your doctor about possibility that the formula is not so suitable for the baby. So those are some of the signs. So acting fussy, unwell, has some blood in the stools or loose stools, or even no stools or hard stools, then you can consider there's something, an issue with the formula. Yeah, so those are the common things. Common causes.
All right, thank you for that. And then also, is it normal for newborn babies to cry when they poop?
Okay, newborn babies, yes, anything, they will cry for anything, not just for poo-poo, because they are new to the world. Everything is a learning thing. So especially things like poo-poo, or that is a little uncomfortable, they have to sometimes strain a little bit, push a little bit. So it's quite normal that they cry, because it's not a natural thing for them. They still have to learn it.
Okay, so once a baby is weaned on a normal diet, but they have constipation, so what can the parents do if that happens?
Constipation, yeah, there's a play between a few things. There's perhaps the baby's not having enough liquid or water. The other thing is not enough fiber, so not enough green vegetables, fruits, fiber. And maybe not enough, activity. So usually this the play between these three things. So we can ask parents to increase the liquid intake or the water intake in the child. Fiber also must increase and become more active. Those are some of the things. And depends on if baby is on formula or breast milk. You have to see if it's something due to the formula causing the constipation, or is it truly constipation? Sometimes parents will say, oh, it's constipation, but constipation, really the definition is it must be difficult to pass. The stools are difficult to pass. Now, if you don't go every day, let's say you skip a day or 2 or 3, but it's soft, you cannot call that constipation. So we must really clearly define it. If it is truly due to difficult passage of stools, really hard, and then baby is straining and stuff like that, then we will say do those three things: increase water intake, fiber, and also more active, and then consider the formula change a little bit, and occasionally may need medication. I will cover this topic in the future lah, because it's quite a big topic, and it's interesting also. There's little details into it.
Okay, thank you, doctor. So another question which was related to the previous question, does this mean that it is normal for newborn babies to strain?
Yeah, absolutely. So it's related to that first question with the second question with baby cry when they poo poo. So it's normal when they strain, as long as the poo that comes out, right, it's soft, it's easy to it's easy to pass. It is just how they are learning to poo only. It's not to do with the stool problem, especially if the stools are soft, very soft and mushy, it's fine. However, if baby cries or strains and then you see the poop come out is hard, that's a problem. Then you have to see the doctor.
Okay, thank you, doctor. So the next question is it true that newborn babies cannot drink plain water?
Yeah, less than 4 months old babies, we don't really recommend drinking water, simply because they are fully on either breast milk or formula, and those things are more than 90% water. I mean, it's water-based, it's liquid, so plenty of water there, so they don't really need anything extra. You can, clean the mouth a little bit, but really babies don't need that. They won't get heaty, and no matter what formula they are on, they won't get heaty. Okay, so no need to give water at all for babies. Okay, that's, I think, a very common myth that olden days people like to say that if you're on formula, you must give baby some water. Actually, that's not true. No need one. Formula or breast milk, they have high water content, so they don't really need any extra water. Maybe after 4 months old, or even when they start solids, then maybe consider giving some water, because solids, you need more water already, and by then the body size also increase, which means you need more liquid as well. But young babies, newborn only.
Okay. So our next question is, can babies get sick from frozen breast milk?
Oh no, absolutely not. Frozen breast milk, of course, you have to defrost, freeze it properly. You cannot put it near the sides or the back of the fridge. You must put it in the coldest place, which is right in the middle, because all the sides of the fridges, they are the mechanical part, which is the hot part. So don't go there. Go put all the frozen breast milk, store it in the middle of the freezer. If you store it properly, frozen breast milk, there's nothing wrong with that. A lot of mothers who nowadays, they have to pump, they have to work, right? So they have to pump their breast milk. They have to store it properly. So frozen breast milk is fine, and then you defrost it properly and use it properly. It's absolutely a good substitute to direct breastfeeding.
All right, so our next question actually is, presumably this is for when babies are pooping. What can new mothers do to reduce or soothe the crying babies?
Soothe or crying babies? You mean when they are...
So like when they are pooping and they cry, like, is there anything that the mother can do to calm them down?
Usually it's just, it will pass, it's okay, and as long as they release the stools, they should be fine. So nothing majorly that you have to do. You can maybe massage baby's tummy a little bit, or you can do the bicycle exercise. You grab baby's feet, and then you do a bit of like this and that. So they are doing like a bicycle motion, like riding a bike. You can do that to help them pass the poo-poo. But usually it's very short-lived, so it's fine. But if you're talking about things like colic, babies get a bit colicky, gassy, that's a different issue. That is not because of the poo, that is because of certain gassy, a sensation of discomfort in the baby lah. It can be from the tummy, it can be from other things, but that's a separate topic. But while pooping, then you can just massage, or you can help lift, sort of try to do you lift up the knees so that the baby can let go of the stools more easily. Because it actually, to be honest, it's quite hard to poo when you're lying flat. Think of yourself, if you have a stomach ache as an adult, do you poo lying flat on the bed? It's not easy lah, huh? So the best position is actually more upright, and then you can help pushing the knees up to the chest lah. You can hold the baby this way as well.
Okay, and I think this will be the last question for this session. So if do newborn babies get gassy? And if yes, then is there anything that mothers can do to help with the gassy pain?
So I was about to talk about that, like the colic part. We usually attribute colic as gassiness, but actually it's not proven as yet. Colic is just a symptom where the baby cries a lot, cry more than, they say more than 3 hours a day for 3 times a week for, for 3 weeks. That's the definition. But I actually see a lot of colicky babies where certain measures are taken, certain measures can help them get a little bit better. You can sort of carry the baby and walk around. So a little bit of motion calms them down. White noises, those sounds that you can, you can go to YouTube and turn on some, 12-hour white noises. So some of these sounds, repetitive sounds, rain sound, wave sounds can help soothe them. Talking to your baby also soothe them, but not loudly, just calmly, like that, talking. Carry the baby around, rocking motion. You can massage the tummy. You can also, again, do that bicycle exercises, just move baby a little bit, move their legs. You can also give some colic medicine like Dentinox. They will help break the trapped gas in the baby's gut. What else to do? You can also just try to see if baby is hungry or not. Try to check the temperature of the room. Is it too cold, too hot? Basically, these babies operate in a sort of very, how to say, their environment has to be nicely controlled to make them happy. Okay, but there are ways, just minor things that you have to do to calm them down. There are certain measures. So as I mentioned, those shaking, a bit of walking around, holding the baby, or swaddling them may make them feel a bit better. They just want to feel secure. That's all.
Okay, thank you, doctor. Actually, we have one last question.
Sure, no problem.
So, a participant is asking if gripe water can be given to babies.
Gripe water, it's been used over the years so many times. No real, I have no real comment on that. I personally never use gripe water on my kids because I don't seem to see that it worked on some of the patients. But again, this is something purely up to the parents. You can use it if it does help, whether because of, psychologically or truly that medication work, you go ahead and use it. But if it's not helping, switch to some other methods. I think it's kind of like do as you like lah. Anyway, it's something that's been used over so long. It's a common thing to use. But I would say if there's no use to it, don't use it anymore. Okay. But if you find that there is benefit to using it and then baby seem to improve, then go ahead by all means.
Okay, thank you so much, Dr. Y, for your time. But before we wrap up, doctor, do you have any last words for our participants?
So basically, I mentioned this several times, as you know, is that doesn't matter how your baby's poo look, okay? As long as baby is happy, thriving, gaining weight, and the stools pass easily, don't get too nervous. But it's okay to come and see me. I can help you out if you feel worried about it, okay? I know stools can be a very frustrating and stressful thing on parents, so we are here to help. Okay, that's all.
All right, so thank you so much, doctor. And for our participants, again, if you would like to find Dr. Waikoni for consultation, she is available at Bright Star Baby and Child Clinic in Nadi Bangsar. So thank you, doctor. See you.
Thank you.
All right, so for our participants, do stay tuned for a live demonstration